So we're going to go over pericare with our patient who happens to be incontinent and wearing briefs. But we'll also talk about some of the other things that are used in facilities. So sometimes you have mesh underwear that a patient can use, and you can maybe place a pad inside there, so helps prevent them from feeling wet, or if they have leaks or anything. So mesh underwear, and then it's disposable and you can give them a new one if and when needed. This is a sample of the brief, the same one that our client is wearing. Different sites have slightly different brief styles or brands, but for the most part they're all fairly similar in function, etc. So you'll actually see these lines going down it, these yellow lines. They tend to change color when they're wet, so you sometimes might see UAs or nurses checking the client and looking at the outside of the brief to see if the lines have changed colors. You don't want to solely rely on that, especially if the patient's telling you that they had to go or that they went, because sometimes depending on where the matter is sitting, you may not see those lines change color necessarily. Some sites have a system where they have sort of like a tape measure that's color coded to the different colors of briefs. And they measure the patient from hip to hip to get the right size, because as you can probably imagine, for adult size briefs, as with children too, or infants rather, that size is really important. You don't want it to be too tight and cutting off sort of areas, or pinching the skin, or being too tight and uncomfortable, and then also maybe not collecting the stool or urine as well. And then you also don't want it to be too big and baggy. Again, it may not collect the way that it's intended. So generally in sites, the brief sizes are color coded. So white, for example, is often the smaller size, blue is medium, and then yellow is larger. But that's just for example from some of the sites that I've seen, and they might change contracts. So you would just want to get familiar with the supplies that your site carries. The other things that you're going to need to perform pericare, again, depends on the site. Some places will use Shield or Sage. It's a Sage product, such as the brand name. They use these types of wipes. So they sometimes are kind of individually packaged like this. So you bring a package into a room, open it up, and then you can take these wipes out. These wipes are really nice because they're soft, so especially for patients who are experiencing incontinence and having to be cleaned often. These are nice and soft on the sort of like delicate areas over time, and they also have barrier or lotion sort of embedded in them, so it kind of helps protect and keep that skin nice and intact as well. Some places will actually warm these bags, so they come out of a warmer, so it's extra nice for the patient that it's not kind of a cold, wet cloth going on their skin. If they're a little bit warm, that's great. So we have sort of another version of that. This is just a bigger bag. You generally won't see a bag of this size in facility, but same idea, those barrier cream cloths are sort of those pre-moistened wipes. Your site may just do kind of traditional style of a clean basin and use warm water and soap, and then face cloths and towels, etc. So you just want to make sure you have enough supplies to kind of get the job done, or you may be asking for someone to grab you things sort of in between. We have a disposable blue pad in here. You may want that to use, especially if you're using the basin version, because you may want to collect your dirty supplies somewhere so you're not soaking the rest of the bed. You can kind of set this up to put your dirty or used cloths on that. And then when you're done, sort of collect this up and put them in the appropriate soiled linen container. Whereas with the pre-moistened wipes, you're just going to be throwing them out as you use them. Another system that you may see, this is the Sween brand, but you may hear it called Sprome and see it come in a slightly different container or bottle. But this is no rinse sort of body wash. So it's again used with cloths or sort of soft napkinette type towels. And certain facilities still do stock this and would like you to use this on incontinent patients and residents. So it just depends on the site again. So what we're going to demonstrate today is using the barrier shield wipes for our patient. And we have his replacement brief. We have clean gloves. We're going to clean our hands before we start. It's a bit sticky. We're of course going to introduce ourselves to our patient, explain what we're doing. Oftentimes for a client, if they're incontinent and not able to help you, you'd want to make sure you have a second healthcare worker, healthcare aide or nurse helping you out with the turns and transfers. But we'll just go over it as if our patient today, Jake, can help us turn and he can reposition himself and hold himself on his side. So you want to maintain privacy as best you can. You can bring in, if available, like a flannel blanket to kind of keep the top of your patient warm. We're just kind of going to do it sort of to show everything though right now. We'll fold your blankets back here. If the blankets are soiled, you're going to want to change those, of course, after you're done changing the brief. Same with the gown and same with this incontinence pad underneath. You'll change what you need to as you determine what's soiled on the patient. So this is done up a little bit messy here, but generally adult briefs are very similar if you've ever worked with or seen children's diapers. We don't call them diapers though, because that can be a demeaning term. So oftentimes we call them pads or briefs or incontinence pads, etc. So they have these similar tabs on them that you're going to pull back. I like to actually fold those tabs in on the excess here underneath, because oddly they do kind of stick to, they can kind of catch on skin sometimes. So just kind of folding them up helps prevent that. And you want to do the same here on the other side. And we want to make sure that we're following those principles of good body mechanics. The bed actually could be a little bit higher in this instance. We want it to be at waist height of the shortest person that we're working with. And again, we're starting at the front. We're going to take down the brief here. And so you may see the urine or stool. Again, you might have seen the lines here change color, indicating, or the patient might have just told you, I was incontinent, or I went to the bathroom in my brief and it needs to be changed. So we're going to get our supplies ready here. You can put it close to us on the bed. And we're going to clean. This one's still clean here. Kind of fold it up a little bit. For a male, we're going to clean from the urethral meatus up towards the glans here and then along the shaft, depending especially on what got contaminated. If it's urine, it's pretty quick and easy to clean. If there's stool sort of around the scrotum, you're going to also want to clean that off using, of course, a new part of the cloth to clean off that area. And you want to make sure, again, that you're moving any sort of contaminants away from that urethral meatus so that it doesn't kind of go up and create a urinary tract infection potentially. So we're going to clean that area with as many wipes as we need to, trying to preserve them in a way that we're using sort of a new clean part of the wipe when we need to. If the patient, again, is not circumcised, we're going to retract the foreskin and we're going to clean around that glans with the foreskin retracted. And once everything is clean and dry there, we're going to make sure to remember to return the foreskin so that you avoid any episodes of phimosis, which can be really painful and even traumatic and damaging to the patient's genitalia. So again, you're going to clean from the meatus up and clean the general area. Kind of move around what you need to. It can be helpful in males and females to have them sort of spread their legs to make sure you get in those folds and creases depending on sort of the amount of fecal matter, etc. that they had. So we're going to ask our patient to help us and turn himself onto the other side so we can clean his backside. It's a good idea to tuck the brief that's on this side underneath their hip, kind of as best you can, or have the person that's standing and assisting on that side kind of tuck it for you. So he's going to reach for the side rail. And again, using our proper body mechanics and our slider sheets if we need them underneath him, but he's able to help us. So now we're going to clean the backside, and we're assuming sort of this brief is contaminated with stool, etc. So we're going to take out a new wipe here. Generally they're a little bit easier and don't come out a bunch at a time. And again, we're going to clean the scrotum area that needs to be cleaned, getting a new part or clean part of the wipe here and cleaning up the backside. You can, if you have the garbage can handy nearby, that's a great spot to put this. You can also collect it in the dirty or soiled brief, because that's going to be going into the garbage after as well. So you do as many wipes as you need to get the area nice and clean. Again, make sure you're cleaning in any of those folds and creases, and that you see no stool or urine remnants, and you're letting the skin dry as well. A great thing to do when you have your patient in this position, as you're helping them do pericare, is to assess for their skin condition, right? So you want to look at those ischial tuberosities, the sacrum here, making sure that no pressure ulcers are starting in any areas that you can sort of inspect when they're in this position. It's just a good time to sort of mention that. So we're going to get rid of this brief. You can kind of fold it all up cleanly like that. And we're going to get our new one out. And the tabs go at the back, or sort of at the top. And we're just going to open it up like this. And you'll want to kind of line it up so you know it's going to fit on their bum. And then we can ask our patient to carefully roll back. I should also mention, if we need to change, say, the soaker pad at this time, it's a good idea to roll that up as well underneath your patient. Put the new one here sort of halfway here, and then you'd want to tell the patient you're going to be rolling over a bump if you did have to put a soaker pad there. So now we're going to roll him onto this side. Again, he can help us, but we'd want to be using proper body mechanics. And just get our, pull out the other side sort of that brief there. And then you're going to open these up and just kind of come pulled apart there, or pull them apart. And we're going to do up our sort of paper Velcro tabs here. And same on this side. At this point, I like to take off my gloves, clean my hands before getting the patient sort of back into a covered, comfortable position, assuming the rest of their sheets were clean, etc. And just reminds me that if you do happen to contaminate your glove at any point with stool, you would want to take them off, clean your hands, and grab new gloves. So it's a good idea to have hand sanitizer and a box of gloves nearby in case that does happen, because you don't want to be sort of spreading that stool around that's on your glove inadvertently. Another really important thing to mention with pericare, or really any type of care that you're doing with your patient, is to offer them the option of helping out in any way that they can, because if they're able to, it can be really awkward or uncomfortable or intimidating to have a nurse come in and just start kind of doing things. So you want to make sure you're dialoguing with them throughout, telling them, explaining what you're doing, talking to them, encouraging them to help where and when they can. That'll help promote independence and sort of that feeling of control over their own body for sure, especially when we're talking about intimate areas like the peri area and cleaning, etc. So that's it for male pericare and brief changing. So cleaning of a female is similar in a lot of ways, but also different. So it's important to go over. Again, you want to get your cloth. You may want to fold it up so that you can access sort of a different corner of it when you contaminate one side. So if there was stool on the outer labia or labia majora, you're going to want to clean that off, of course, first. And going in that direction that we talk about from front to back. I think everybody sort of understands that and knows it in theory, but for some reason when a patient's laying down, we do sometimes sort of see that tendency to want to go this way because it's easier for us, but we want to be very careful and cautious that we're going in this direction of top to bottom. So from urethra sort of towards the anus, and then throwing it out. And then moving in and retracting or holding open the labia as you need to sort of clean inside. And again, going in that direction from top to bottom, adjusting your cloth and getting a clean side of your cloth, and throwing out. And then that last wipe down the middle. So we're going to the center last, so from urethra to anus again in that direction. And then the rest of the principles are the same for female when they're on their side, and how to replace the brief that's underneath them. But those are the major differences between male and female.